Bob,
Hi, Lucian.
good to see you.
It's good to see you too. How are you?
I'm doing good. How about yourself?
Doing all right.
But you're really fortunate that the medication is working so well for you.
You think this will keep working?
I think so, if you stay with it.
Through most of this country's early history, mental illness was regarded as an evil, sinister thing. The mentally ill were often treated like criminals and imprisoned. By the mid-19th century, however, there was a move to establish facilities, originally known as asylums, for the care and treatment of the mentally ill. Though asylums attempted some treatment, by and large their tools were limited to physical restraints. In the mid-1950s, the care of patients with mental illness began to experience a marked change. In the search for a different anesthetic agent, an anesthesiologist developed chlorpromazine. While this new agent's effects were poor as an anesthetic agent, when it was given to individuals with schizophrenia, it proved useful in sedating and alleviating psychotic symptoms. In 1954, chlorpromazine, also known by its trade name Thorazine, was first used therapeutically in this country. The modern era of drug therapy for the treatment of schizophrenia was born. Since that single discovery, the development of psychotropic agents has become increasingly more complex and diverse. This is the first of 5 programs on caring for patients with psychiatric disorders. This program looks at assessment, intervention, and treatment of patients with psychiatric disorders. Subsequent programs look at patient care and medications used in the treatment of schizophrenia, bipolar disorders, depression, and anxiety. After viewing this program, you should be able to describe how some chemical agents function as neurotransmitters in the brain. Understand how psychotropic medications are used to stabilize mental disorders. Verbalize the effective administration of psychotropic medications to treat patients with psychiatric disorders. Recognize side effects of psychotropic medications and precautions to be taken with patients receiving them, and describe various strategies used by the interdisciplinary team to help the patient with psychiatric disorders. The obvious place to begin an examination of psychotropic medications is with the brain, more specifically with neurotransmitters. Generally speaking, psychotropic medications have some impact on the neurotransmitters. The neurotransmitters are the chemical switches of the brain, and they are responsible for transmission of thoughts in a person's mind. Research indicates that there are hundreds of different neurotransmitters involved in the transmission of nerve impulses. The interplay is complex and not fully understood. But it is known that in some individuals, this delicate interplay of chemical agents is unbalanced, and this can lead to mental difficulties. In many cases, medications can help to stabilize or restore this delicate balance and help the individual lead a more normal life. Psychotropic medication therapy is designed to do one of 3 things: block excesses of certain brain chemicals, enhance the effectiveness of existing chemicals, or mimic and improve upon the action of deficient chemicals. Medications can be sorted according to common pharmacological properties, and mental illness can be grouped according to their neurobiological basis. The challenge of effectively using psychotropic medication to treat patients with psychiatric disorders is to make sure that the correct medication reaches the patient and that this medication produces the proper response with the fewest problems. Medications are referred to either by their generic name or their trade name. The generic name is the accepted common chemical name. The trade or brand name is given by the company that manufactures the chemical. The original manufacturing company owns the patent and has exclusive rights to sell the drug for 24 years. When those rights expire, the original company or others may market the drug under their own trade names. Though a medication may have numerous trade names, it has only one generic name. In this program, the generic name will be followed by the trade name of the drug. For example, clozapine, Clozaril. Medications that are used to treat mental disorders are known by their general term, psychotropics. Within the group of psychotropics are different classes of agents used to treat the various disorders or combinations of disorders. Antipsychotic agents, also referred to as neuroleptic agents, are used to treat a number of psychotic symptoms, including hallucinations, delusions, and paranoia. One such agent is chlorpromazine, thorazine, mentioned earlier. A more recently developed antipsychotic agent is quetiapine, Seroquel. Anti-Parkinson agents are generally used to counteract uncomfortable side effects of antipsychotic agents, such as stiffness and tremors. An example of such an anti-Parkinson agent is benztropine, Cogentin. Antidepressant agents are used to treat the symptoms of acute and chronic depression. An interesting side note is that a number of the drugs in this classification are effective in controlling neurogenic pain not addressed by standard analgesics. Some agents within this group are also used to treat some anxiety disorders, such as panic and obsessive-compulsive behavior. Sertraline, Zoloft, and fluoxetine, Prozac, are commonly prescribed antidepressants. Anti-manic agents, also referred to as mood stabilizers, are used in the treatment of bipolar disorders. While lithium, Escalith, is still the mainstay of this treatment, divalproex sodium, or Depakote, is increasingly being used. It is an anti-seizure agent approved by the FDA for treatment of manic episodes found in bipolar disorders. Carbamazepine, Tegretol, is another anti-seizure agent that is a useful substitute in individuals unable to tolerate lithium or Depakote. Anxiolytic agents are used as sedatives and to reduce anxiety. Medications in the benzodiazepine group, such as diazepam, Valium, are generally used on a short-term basis because they have the potential for development of dependence or abuse. A relatively new anxiolytic agent, buspirone, Buspar, provides less sedation and no apparent risk of dependence. However, it is not cross-tolerant with benzodiazepines and is most effective in people without previous benzodiazepine therapy. Another way to look at psychotropic medications is to categorize them by their chemical action within the brain. One group of medications, referred to as first-generation agents or typical agents, blocks dopamine, a type of neurotransmitter. First-generation medications, such as chlorpromazine, thorazine, which treat schizophrenia, have long track records and are widely used today. Almost all are available in a less costly generic format. Also, there is a good understanding of these products' side effect profiles. Though these agents are widely used, about a third of individuals impacted with mental illness prove to be refractory to these first-generation agents. In other words, their illness is unresponsive to this treatment. For the remaining two-thirds of patients, these first-generation agents provide a good response. In some patients, the side effects of first-generation agents can be extremely troublesome and may lead to noncompliance by the patient. For instance, haloperidol, Haldol, commonly used to treat schizophrenia, may create neurological complications seen in the form of movement disorders. These movement problems include muscle stiffness, tremors, restlessness, and in some patients, diminished movements. Other side effects commonly experienced with the use of first-generation agents include dry mouth, constipation, blurred vision, and sexual dysfunction. These side effects vary in severity depending on the individual and the agent used. The second group of agents, which has been developed more recently, is referred to as second-generation or atypical agents. Medications within this group treat a broader spectrum of psychiatric symptoms and generally cause less movement disorders. Unlike first-generation agents, which primarily impact the positive symptoms of schizophrenia, hallucinations, delusions, and paranoia, these newer agents also treat the negative symptoms of the disease, apathy, anhedonia, and social withdrawal. Some medications within the second generation block numerous neurotransmitters, including dopamine and serotonin. Due to their chemical action in the brain, chemicals in this group are also referred to as serotonergic, dopaminergic antagonist, or SDAs. One example is risperidone, Risperdal. The second-generation affective medications directly impact the neurotransmitter serotonin by preventing it from being taken back into the nerve. One example of such a medication is fluoxetine, Prozac. It is a second-generation antidepressant agent. Due to its more focused neurological action, it is categorized as a selective serotonin reuptake inhibitors, or SSRIs. The SSRIs are not prone to sedation, cause fewer problems with eye and mouth disturbances, and are far less likely to be lethal in an overdose than SDAs. The reduced intensity of the side effect profile may lead to greater patient acceptance and compliance with prescribed therapy.
When a new patient comes onto your unit, you make contact with him if you can. If you can't make contact with him, that tells you something right there. But you look at him, you talk to him, you try to get him to talk to you. You just start trying to build rapport.
In the most general terms, patients who are mentally ill are in a state where they can no longer function normally in their environment. The patient may present with numerous signs and symptoms. Many of these overlap from illness to illness. For example, anxiety symptoms are seen in over 96% of patients who suffer from depression.
Sometimes I feel jittery, like my heart's skipping. It's scary. I don't like it.
Many somatic or physical problems can be seen in the individual with anxiety disorders. Symptoms such as upset stomach, headache, rapid heart rates, and sweating. The individual with schizophrenia may hear voices, have delusions, and may become paranoid and withdrawn.
I don't know what I'm doing.
Why?
I'm not sure.
You been at the park?
The park?
The park. You been there?
Is it safe there?
The person with manic depression may also have delusions and hear voices. They tend to become highly anxious and easily irritated.
You know, Sean, sometimes you're just like your dad. I don't be in a good mood when we're through without somebody acting up about it.
One of the most important skills in caring for patients with mental illness is the use of therapeutic communication techniques, empathetic listening, and appropriate response to the patient's needs.
Bob?
Yes.
I'm Lucian Morin,
Hi, Lucian.
home health nurse. I called you yesterday.
I remember, yes.
May I come in?
Come on in.
Thank you. Wow. I like the way you decorate your apartment.
Have a seat?
Yes, thank you.
Many patients may not even recognize their mental illness or medication side effects. Closed-ended questions usually provide little insight into the patient's problem because they ask only for a yes or no response.
Yeah. What was life like for you before you started taking the medication?
That's pretty scattered, pretty disorganized.
In communicating with the patient, the use of open-ended questions, which seek broader responses, can greatly enhance the health professional's understanding of the patient.
I noticed when you walked in the kitchen to get the coffee that your arms were looking a little stiff and maybe the posture in your shoulders.
I feel like I have some stiffness in my neck and upper back and
Asking the patient specific questions about eating, socialization, sleeping, grooming, how he feels physically, and his treatment expectations facilitates the development of a professional helping relationship. Effective assessment and care plans rely on a complete and accurate database. As the patient's confidence in the caregiver develops, so too does the database. It is also important to observe and document nonverbal gestures, body language, and general physical appearance. In documenting the patient's responses, write down any direct statements that may be significant. Throughout the assessment, of course, an effort should be made to maintain an objective view of the patient. There are a number of tools or assessment instruments that are used to help determine the presence and degree of mental illness. Though psychologists generally conduct these tests, the healthcare professional may need to refer to the results of the tests or recommend that a particular test be given. These tools may help the treatment team arrive at a clearer diagnosis and develop a more effective treatment plan. The need for intervention is most obvious when the patient's behavior is getting in the way of his day-to-day life, or if behavior is impacting the safety of the patient or other individuals. If the patient suffers from a psychiatric disorder, important considerations are: is the person a danger to himself or others? Does the person want help? What are the intervention options? And what is the goal of the intervention?
Michael, talk to me. You're not eating, you're not sleeping. You've been sitting here for hours. What's going on with you?
Well, I have every reason to be happy, but I'm not.
Mental illness may arise slowly, and it may be difficult for the patient and family and friends to acknowledge that there is a problem. It may also be difficult for the patient to understand or accept that there are treatments available for mental illness. This may be particularly true if the patient is psychotic or sensitive to the stigmas associated with mental illness. As the individual becomes aware of his or her mental illness, the stages of loss may apply, beginning with shock, moving to denial, anger, grief, and finally to acceptance. Due to the common trial and adjustment process of its diagnosis and treatment, mental illness is most effectively addressed by a team of trained health professionals who use a variety of assessment procedures. Psychiatrists, psychologists, nurses, pharmacists, social workers, and others comprise the interdisciplinary team. Each member contributes to an effective treatment plan. The process also involves the patient, as well as friends and family of the patient. Administering any psychotropic medication often involves many adjustments. It may take time to find the proper mix of medications at the correct dosage with the fewest side effects. In some cases, decreased depression accomplished by antidepressant therapy may temporarily give rise to thoughts of suicide. Self-harm assessment must be incorporated throughout this process. In all cases, the healthcare team should educate patients that while some side effects may be an unavoidable result of the medication, it should still be taken because it provides mental stability. Licensing and accreditation agencies require healthcare professionals to inform their patients of medication side effects. You need to be able to demonstrate that the benefit of mental stability outweighs the risk of the medication side effects. The patient and the family should be educated to report any effects they note, and they should be warned about any danger signals so they are prepared to ask for help. The degree of intervention varies with the severity of the illness. It also varies by setting. The patient who remains at home may need help only in maintaining a medication regimen, while the patient in a hospital may require a more intense level of intervention. Regardless of the setting, it is critical that the healthcare provider engage the patient in a calm, genuine manner.
How have you been feeling?
I've still been feeling really bad.
The patient may be anxious and afraid, and empathetic listening will help establish trust and rapport. It is important that the professional listen and verify his or her understanding of what the patient is trying to communicate.
They have to accept and go through a grief process when someone is diagnosed with a mental illness, because you've lost an area of functioning in a way, and you have to take medication. And this raises a lot of issues for people to deal with.
When you're a young person and somebody tells you you have this lifelong illness, it's very similar to a diabetic patient finding out that they're diabetic. It means conformity. If the diabetic doesn't conform to their disease, then bad things or unhealthy things happen to them.
The treatment of patients with psychiatric disorders can employ various strategies. Medication may be part of the program, as well as individual counseling, group therapy, and even changes in diet and exercise. Though psychotropic medications hold the promise of helping the patient with mental illness lead a fuller life, they are not cures. They are agents used to help the patient regain some control over her illness. An important issue in administering these medications is knowing just what symptoms are expected to improve. An understanding of the patient's functioning before and after beginning therapy is also important. The health professional should appreciate that medication has its limitations. Though drug therapy should lessen the tendency toward mental instability, the patient plays a significant role in determining whether his or her illness remains in remission. As in diabetes or hypertension, patient conformity to treatment is of paramount importance.
Well, I don't know why they can't increase my dosage. I just feel like I would feel better if they did.
Constantly seeking the dose that obliterates the symptoms may cause a series of undesirable side effects that require more interventions. It is generally agreed that it is better to use a dose of medication that stabilizes the patient with some symptoms and then use other supportive therapies like biopsychosocial rehabilitative or cognitive therapies to help the patient better cope with the condition. In some cases, the patient may be given orders for medications on a PRN basis.
It's not really helping the client if you enable them to go for the PRN medication every time they're upset about something. That's not what it's intended for. The ideal would be to help the client to learn how to cope in a healthy way with situations in their environment that upset them.
Healthcare providers need to be aware that psychotropic medications are a double-edged sword. Side effects can jeopardize compliance and risk the health of the patient. In some cases, the medication's side effects may resemble symptoms of the disorder that is being treated. For instance, a patient taking a first-generation antipsychotic may develop akathisia, a frustrating restlessness. The resulting irritability or agitation may be mistaken for a component of the patient's mental illness. Most psychiatric medications have a direct impact on the cardiovascular system. Precautions need to be taken if there is a drop in blood pressure. Such a drop can increase the risk of a fall. This is especially important in the geriatric patient population. In such a situation, the patient must be cautioned and taught to stand up slowly, stay well hydrated, and avoid overheating. Standing and sitting blood pressure measurements provide empirical evidence in monitoring client response. Most agents are metabolized by the liver and excreted primarily through the kidneys. Pre-existing liver conditions and/or kidney problems need to be monitored to ensure that the medications are being properly metabolized and excreted. Accumulation of the medications in the system could have toxic consequences. Routine lab tests may be prescribed by the psychiatrist to monitor liver enzymes, blood components, electrolyte balance, kidney function, and blood levels of medications. It is usually best to time the administration of medication to suit the patient's normal routine. Ideally, taking these agents should not interfere with work, school, or social activities. Most medications can be administered at bedtime, allowing the patient to sleep during the time he will be experiencing most side effects. There are some psychotropics which are best taken in the morning or at noon. In many cases, psychotropic medications need only be taken once or twice daily due to their long-acting nature. Work with the patient to establish a medication schedule that provides the greatest relief with the least disruption. Psychotropic agents are effective only if they are taken. A major factor of their success is compliance. Fears of addiction, side effects, and forgetfulness may jeopardize compliance. Educating the patient about the medication regimen is a critical part of administering their prescribed agents. The healthcare provider must continually assess whether the patient is complying with the medication regimen.
How is your medication?
Real good. I feel great. Excellent.
Sudden withdrawal from psychotropic agents can have disastrous results. If the patient refuses or is unable to comply with the regimen, the healthcare provider needs to communicate this to the doctor or psychiatrist promptly. In caring for the patient with psychiatric disorders, objective documentation of the patient's behavior, mood, and functioning is critical. It is important to observe the whole patient. Poor diet, stress, and substance abuse can upset the balance needed in effective mental illness management. Thorough and concise notes should reflect the patient's condition and his or her response to treatment. Such documentation can help the healthcare team determine the most effective treatment, medication, and dosage. Good care by the healthcare professional requires complete assessment of the patient, familiarity with the markers of his or her illness, and knowledge of the range of treatment available, including medications. As the patient's response to medication is monitored, watching lab values and for symptoms or side effects, it is important to also listen to the verbal and nonverbal messages of the patient. The assessment helps to ensure appropriate and effective treatment.